Eggs have long been a staple in many diets, prized for their high-quality protein and essential nutrients like choline and lutein. However, for decades, eggs have been at the center of debates due to their cholesterol content, which led many people to avoid them. Yet, after a comprehensive 48-year study on eggs, cholesterol, and evolving dietary guidelines, new insights have emerged that challenge previous assumptions and provide a clearer picture of their role in our health. Historically, dietary recommendations surrounding cholesterol have changed significantly. Back in the 1970s, the average cholesterol levels in the population were much lower, and eggs were often singled out as a food to limit due to their high cholesterol content. This led to widespread fear, and many people restricted egg consumption to reduce their cholesterol intake. However, modern research has shown that the cholesterol found in food, particularly in eggs, has a minimal effect on blood cholesterol for most people. As a result, in 2015, the United States Dietary Guidelines removed the specific cholesterol limit of 300 milligrams per day, acknowledging that dietary cholesterol does not contribute significantly to heart disease risk for the general population. This shift in understanding has been reflected in the consumption of eggs over the past decades. Data from the Rancho Bernardo study, which tracked egg consumption from 1972 to 2021, shows a noticeable trend. Between 1972 and 1974, participants consumed an average of 3.6 eggs per week, but by 1988 to 1991, this dropped to 1.8 eggs per week, reflecting the influence of early cholesterol guidelines. However, by 2021, egg consumption had climbed back to 3.4 eggs per week, nearing levels from 1972. This pattern demonstrates how dietary guidelines can shape food choices and how changes in those guidelines can lead to a gradual return to previous habits. Interestingly, gender differences have also played a role in egg consumption throughout the study period, with men consistently eating more eggs than women. The research also highlighted how the use of cholesterol-lowering medications influenced egg consumption, particularly in the earlier years of the study. While people on cholesterol medication tended to eat fewer eggs in the 1970s and 1980s, this relationship diminished by 2021, reflecting growing awareness of the new dietary guidelines. Despite the evolving science, some outdated beliefs about cholesterol still persist. In 2021, 22.1% of participants consciously avoided eggs, with 10.2% citing cholesterol concerns. Yet, these concerns are increasingly at odds with the current scientific consensus, which has shown that for most people, the cholesterol in eggs does not significantly affect blood cholesterol levels. This lingering fear underscores the need for continued education on nutrition and a broader understanding of how dietary choices affect health. The study also revealed that factors like education no longer significantly influenced egg consumption in 2021, suggesting that as knowledge about diet improves, more people are becoming less influenced by outdated recommendations. This reflects a growing understanding that diet is more about balance than restriction, and that eggs, when consumed as part of a varied and healthy diet, can contribute to overall well-being. One of the key takeaways from this study is that over the years, our understanding of the relationship between eggs and cholesterol has evolved. While early recommendations might have discouraged egg consumption due to concerns about cholesterol, current evidence shows that eggs can be part of a healthy diet for most people. They provide essential nutrients, and when eaten in moderation, they can contribute to a balanced diet that supports overall health. The important message is that we should focus on the overall quality and balance of our diet, combining eggs with other nutrient-rich foods to fully harness their health benefits.